Some hospitals around the metro are getting slammed, but tonight we're focusing on hospitals which look more like ghost towns. Many rural and community hospitals are struggling. Experts warn if they don't get financial help from the federal government, then some will be forced to close permanently. Investigative reporter Angie Racono picks up this story in Richmond, Missouri.
Okay. Step inside Ray County Memorial.
7.3.
Your visit begins with a temperature check.
Have you been exposed to anybody with any respiratory symptoms?
No. And a few questions.
Have you come in contact with anybody with known COVID?
No. And then you are greeted with silence. There's no one in the lobby. The gift shop is dark. Walk down a hallway or peek inside rooms. It's tough to find a patient. The day we visited, there were only 2 inside this entire hospital. Just 2. The ER was completely vacant. One baby eventually stopped by for lab work, and then another woman.
It's very weird. It's been kind of like, we keep calling it the calm before the storm.
The storm hasn't hit yet. This hospital is ready. Ray County has a plan for suspected COVID-19 patients.
We set it to go into a negative pressure mode, and then we would go in and take care of the patient.
This negative pressure room sits in the corner of the ER.
When we're finished, we come to this point, and then I would take off my isolation gown and put it there.
This is where we would put our COVID patients.
There's a wing in the hospital with plastic zippered curtains, but they haven't treated a single COVID-19 patient yet. Not a single patient.
Our patient admissions have really declined.
Ray County's hospital administrator was willing to sit down with us and reveal what's happening inside community and rural hospitals across the nation.
Even though they haven't been hit with the COVID, it's just the loss of revenue. It's been tremendous.
This hospital is in much better shape than its counterparts. Ray County is debt-free and has reserves. Staff members have been asked to give up just 1 8-hour shift per pay period. But this was not the disaster any rural hospital prepared for.
All of our disaster planning was mainly floated around tornadoes.
Many rural hospitals will not survive without aid. The lifeblood of their programs was serving patients, not waiting for what could and may still happen. Rural hospitals were already closing across the nation. 170 have shut down since 2005. The impact can be seen on this map. 11 million people, or 3% of the population, now lives in a county with no hospital. That's according to Kaiser Health News.
Big key is more testing capabilities.
If you ask what will save rural hospitals, you get a quick, firm answer: testing. And it needs to be accurate, rapid testing.
Rapid testing is 15 to 20 minutes. That's a big difference.
Well, y'all take care. Have a great day, sweetie.
Right now, community hospitals are making the best of things, video conferencing patients for therapies, but they are waiting desperately for testing and support. Many rural hospitals are trying to survive and plan ahead for the fall when they expect a second, much stronger wave of coronavirus. Angie Racono, KCTV5 News.